This is Morning Live. It's time now for our profile feature, and we get to meet Dr. Peter Mushenya, Best Graduating Fellow in Neurosurgery. So the College of Surgeons of East, Central and Southern Africa awarded Dr. Peter Mushenya Best Overall Graduating Fellow of 2023, and this is the first time that a Zambian got to win this overall regional award. Dr. Mushenya, welcome to Morning Live.
Thank you very much. Thank you, Msanda.
Today we are casting a spotlight on you.
Thank you so much.
Congratulations.
Thank you.
It must have been overwhelming.
Yes, it was.
Yeah?
It was
expected? Was it expected from your end?
Well, not really. I didn't really think that I would get the overall best award. I know I put in a lot, but I think well, to say the truth, I didn't expect it.
When you say you put in a lot, is this hours of study? What exactly goes into being given this award?
Well, a lot goes in. A lot of sacrifice, a lot of time spent, studying, time spent. This is a professional qualification. So they look at your competences in terms of the practical aspect of things. So it means you have to spend a lot of time in theater trying to perfect your skill, and a lot of time studying because you need the knowledge aspect of it as well. Yeah. So yeah, it takes a lot.
What does the award mean to you?
Well,
and to you and to the country?
Yes, so it's probably that it's the first time that it's coming to Zambia. Yes,
so this award is very special in three ways, if I may put it that way. One, the neurosurgery training program is quite new in Zambia. It was introduced in 2018, and I'm privileged to be one of the first 6 Zambian trained neurosurgeons under the Zambia College of Medicine and Surgery. And this is the first time that Zambia was sending students or candidates to participate in the COSEXA exams. So again, among the first 3 Zambians to participate in neurosurgery. We've had candidates take part in other fields of surgery, but for neurosurgery it was the first time. And so for the first time, all the 3 of us who went there managed to pass. It's not an easy feat. And
so there's also a possibility of failing.
Yes, a lot actually, a lot. So being the first time, we participated and we all passed, and then at the end of the day, I even, got the overall prize. I think it was very special. Secondly, as you have said, in the 24-year history of the college, this is the first time that a Zambian is getting this overall award. So apart from, just getting the award in neurosurgery, but also getting the overall award. So I think it's quite special in those regards.
Okay, now let's get to know more about you. Who's Dr. Peter Mushenya?
Okay, yeah. So
where were you born? How was your childhood like?
All right. So Dr. Peter Mushenya is a young Zambian doctor. I was born in Kitwe Central Hospital in the year 1988. I was raised in Kitwe. I did my primary and secondary school in Kitwe. I did my primary at Mitanto Secondary School, and as well as the Pusukilo Primary School. I think these are now secondary schools now. And then I did my high school at Mukuba High School. Well,
really born and raised Kitwe, eh?
Yes, so everything Kitwe. I came to Lusaka in 2007 when I came to the University of Zambia, School of Natural Sciences. Yeah, so from there, I managed to get quoted into the medical quota and started my medical training. I graduated as well with a distinction in Bachelor of Science.
So you've always been a best student?
In human. Well, well, I've tried to work as hard as I can, and I think the results have come through. Yeah, so I graduated in 2011 with the Bachelor of Science in Human Biology with distinction. And in my 5th year, again, I was the best student at junior clerkship level, which earned me sponsorship to have an experience in the UK So I spent about 6 months in Brighton at the University Hospital of Brighton and Sussex, just to have an experience of medical training in a more resourceful environment. So I came back and continued my training and completed my Bachelor of Medicine and Surgery in 2014. After that, I went to Ndola. That's where I did my internship, my junior residency, and for about 1 year, 6 months. After that, I went to Chadiza District Hospital in Eastern Province, quite a rural district with no third road, no filling station, you know. It was quite an experience, but I learned quite a lot there as well, in terms of just having the courage to face difficult situations, because sometimes you'd get a patient who's bleeding profusely, and when you look at the time it would take you to transfer that patient from Chadiza to Chipata or St. Francis, which were like the biggest referral hospitals in Eastern Province, it would take you probably 2 hours. And at the rate that the patient is bleeding, may not reach. So you have to kind of make a decision to do something, and sometimes you do things that are beyond your scope. You may end up going to theater, do an hysterectomy, which in places like this are done by senior doctors who've been, you know, doing these things for a long time. But in such situation, you have to do something. And so I learned, you know, to be courageous, to make decisions and stuff like that. Yeah, so then in 2018, I came back to UTH. Dr. Chizia was trying to set up a neurosurgical team. He had just come back from Bedcure where he was working, and he was, you know, looking for young guys who can join him to set up this unit. And we had some discussions with him before that, and he knew that I was interested in doing neurosurgery. I tried, you know, a few times to apply for neurosurgery training elsewhere, but neurosurgery is quite competitive. It's a very complex field of surgery, very competitive. It's not very easy to get into a university to study neurosurgery.
No,
Elsewhere, neurosurgeons are among the highest paid professions, so it's really difficult to get a chance to do it. So when the training program was started here, I think it was a good thing for the country. And you know, from 2018, it's a 5-year training program. And in 2022, the first graduates were produced. During my training in neurosurgery, again, I managed to get, can say, an award from the Federation of International Education in Neurological Surgeons, who sponsored me to have an experience in Italy in spine surgery, particularly spine surgery component of neurosurgery. So I spent about 5 months in 2 hospitals in Italy. One was in Florence, which has the 3rd biggest hospital in Italy. It's quite busy, and there are very, very good surgeons there. So I had an experience to learn, you know, the state-of-the-art spine operations, and also another experience in a smaller hospital in a smaller part of Italy, in the northern part in Udine, and a very good surgeon again, Professor Barbara Capelletto. So I got what I learned from there, and you know, trying to apply it to help our patients here.
Oh, nice. And
then side by side, as I was doing the local training program, I was also doing the training under COSEXA. So under COSEXA, the training is 6 years. So again, I started in
6 years.
Yes. So I started in 2018. In 2019, I wrote my membership exam. So the first 2 years is more like you learn about the basic surgical principles, which cover across all the surgical fields. Then you write an exam. So I wrote my exam in 2019 and became a member. Then the last 4 years, you now focus on your field of surgery. So the last 4 years, I was now focused on neurosurgery. And this is the graduation that...
You've been doing school all your life.
I was about to ask him to say, so what do you do when you're not doing school?
You know, really, this takes up quite a lot of your time. My family complain that, you know, I'm not there for family events, I'm not there for this and that. And you
Are you even there for your own event?
Yeah, so it takes quite a lot. And also, like I think we were discussing in the background, neurosurgery is quite busy even at UTH. We have quite a lot of head injured patients, a lot of children with hydrocephalus. And if we're doing a brain tumor, these are surgeries that will take you the whole day. If you start in the morning, you'll be in theater probably up to 2022.
From morning?
Yes.
Then how do you relax?
I think I can say that, this has become part of who we are. We are used to it.
Are you telling me you don't relax? Because I think you haven't answered how you do that.
No, we do relax. We
what
always,
do you do?
We always find time. I like to watch football. I watch football a lot. I'm a Chelsea
What team
fan.
do you support? Or Chelsea?
Yes.
Chelsea.
Yes. So I do that a lot.
No,
too.
but what about on the local scene?
On a local scene, I support Zesco United because of my time in Ndola. I used to watch a lot of their games at Televi Manwasa Stadium. So from there, I developed a liking. Yes.
So did you attend your own wedding?
Yes, I did.
When did you get married?
I got married in December 2017. So I've been married for 6 years. And I have two lovely children, a 4-year-old boy and a 3-month-old girl.
Okay,
congratulations.
nice.
That's like the newest addition to the family.
Yes.
So tell us a little bit about your nuclear family.
Yes, so I was born in a family of...
No, your own now.
Oh, okay. Yeah, so I'm married to a lady called Josephine Ukevwe. She was born and raised in Lusaka. We met when I was here in Lusaka. And
is she a doctor too?
No, she's not a doctor. She's a banker by profession, but she's just working for another organization where she's just doing some administrative work. Yeah, so we've been married for 6 years, and like I said, we have 2 children.
So let's go back to Msonda's question. Oh, you said you just watch football, you're not doing anything. What kind of music do you listen to?
I listen to some Zambian music. I also listen to a bit of Nigerian secular music, but I'm a Christian, and sometimes I also listen to gospel songs.
Yeah.
What's your favorite meal?
Shima with fish and beans.
Why not beef? Is it because you...
I do enjoy beef as well. I do enjoy T-bone. I know I know a lot of people...
Let on hear his explanation. What's your explanation?
Yeah, I know a lot of people say that, when you're a doctor and a surgeon like me, you may have difficulties to enjoy meat and everything, but I think the experience is different for me. Yeah. We start getting exposed to this thing quite early on in our training. In 3rd year, you start doing your dissections. When you start your anatomy classes, you are given a cadaver, you're given a body, maybe 3 of you or 4 of you or 5 of you, depending on the number, and they say this is where you are going to learn your anatomy from.
A body, when you say a body, what do you mean you're given a body?
A dead human being, really. And so you learn your anatomy from there. You dissect it. You have a dissection manual. You have instructors. And even in your free time, sometimes even in the evening, you would go in the dissection room and you in the evening?
In the night, you're dissecting.
Yeah, so you find that...
And is it true that you're given... Yeah, in fact, let me ask. Is it true that you're given a set of bones and you need to arrange them like in their order, the way the human anatomy is formed? Is that true?
Yes. So you learn everything, really. You learn the bones, you learn the nerves, the blood vessels, everything. So you dissect each and every part of the body.
But despite that, you don't find it difficult to have your beef?
No, I don't.
Doc, listen to this. Doc, listen to this. Babe, I can't sleep. I'm just going by UTH. I'll be back. Do you ever do that?
Yeah, a lot.
A lot.
Yeah.
A lot is the key word.
Babe, I can't sleep. Let me just go to UTH. There's something. I think I've figured it out now. Then you just get in the car and go.
Sometimes you figure things out in the night?
Well, most of the time when you leave at night is because you've been called for an emergency. If you're on call and there's a head injured patient who has come, of course we have different levels at which we are. So maybe there will be someone who's like the first responder, and if they can't handle what is there, maybe the second one has to come in.
So at what level are you now?
Right now I'm working as a senior registrar, as a specialist.
So meaning if they are calling someone, you said there's a first responder, second, so at what level?
Yeah, so right now I'm at the third level, which is...
So it will take a while to get the phone call.
Yes, it will, but you have to make sure that the people on the ground are doing the right thing, so you have to be checking on them at
But
each
how
and
do you
every point.
ensure that you don't get attached to your patients, that you don't carry your workload at home and still think about the patient?
Or the grief of losing the patient?
It's very difficult. To be honest, we do get attached to our patients quite a lot. And that does affect you. When you do a surgery, you go home, you still be thinking about that patient. You still be thinking about, the possibility of something going wrong. So even when you're home, you'll be making phone calls to the ICU. How's the patient doing? At midnight, you wake up, you make a call. It's always with you, and if something goes wrong, it's even more. And sometimes we get attached to patients because we spend so much time with them. You look at what they have, and it's real. We do get attached. It's difficult to completely detach yourself from.
But I must commend you for one thing, though.
So just hold before I forget. This is in line what you're talking about. So, like, how was your experience when you first lost a patient? And did you have to personally walk to somebody to tell them?
Yes.
Or you sent somebody else?
Break the news.
To break the news. I can't say that I cried or anything like that, but of course I felt very sad. And again, breaking bad news is something that we learn in our training. So it's not, of course, it's very difficult because we're humans, and we also get attached to patients, like I said. But we have to be professional, and we have to do our job. So, and that's part of our job, really. If something has gone wrong, we have to have a discussion with the family, go through, and also as we manage patients, we have these discussions at every point. So when we're doing something, we always engage the family, so they get to be part of the management. And when something happens and we lose the patient, it becomes easier for us to go back to them and tell them that despite all our efforts, we've lost the patient.
I was going to say, earlier you did make mention that neurosurgeons in certain parts of the world are the most paid medical doctors. You've stuck around with this qualification. You've been exposed. You've worked in Italy, in the UK, and you still get to stick to our country. What keeps you going?
Thank you very much. That's a very good question. In sub-Saharan Africa, sub-Saharan Africa accounts for about 15% of the world burden of neurological conditions, but yet only 1% of the population of neurosurgeons is actually in Africa in general. And in that 1%, the majority of the neurosurgeons are in the northern part of Africa, in Egypt, Morocco, and those regions. And the ones that we have, again, for the number that is in the sub-Saharan Africa, the majority are in South Africa. So we are talking about very, very few neurosurgeons. The recommended number is 1 neurosurgeon to 100,000 people. But in Africa right now, we are hovering around 1 neurosurgeon to about 2.5 million people.
2.5 million?
Yes.
Wow.
Yes. So in Zambia, for the longest time, we only had 2 neurosurgeons. After Professor Lambert retired in 2004 to 05 somewhere, Professor Chikoya and Dr. Stizia came back from their trainings. Dr. Stizia trained in Cape Town. Professor Chikoya trained in Israel. So when they came back, they were the only neurosurgeons from 2005 up to 2018 when the neurosurgery training program started in Zambia. So you can imagine the burden that we have and the few number of neurosurgeons that we have. So really, I feel like the country has given me this opportunity to train and get this skill. I feel that I'm obliged to give back to this country, and I can only do that by giving back my skill and helping the patients.
Thank you
Doc,
so much.
we need to go, but I've got a trivia question I need to ask.
Sure.
Why are you not wearing your marriage band like me? Is it something to do with surgeons or what?
Yeah, so when we're in theater, we do remove our bands because they've been associated with infections.
Yeah.
But currently, I actually lost my band. My son was playing with it and threw it in the sink. So I'm here to replace it.
Ah.
Yeah.
I thought that maybe it's something that's got to do with your profession.
Yeah, to some extent, yeah.
Thank you so much, Doc, for sharing with us your story. And as we let you go, your word of advice to upcoming doctors.
Okay, yeah, so my word of advice to the young upcoming doctors is that it's possible for us as Africans, as Zambians, to excel and to prove to the world that we are equally capable to achieve the highest level of excellency. And from my experience in the recently held COSEXA conference, after seeing how the Zambians performed, a lot of neurosurgeons actually willing to start sending their students to have an experience here in Zambia, and just because I think they were very happy with how we performed. So I think it's possible, really. That's what I can tell them, and with commitment, hard work, perseverance, and knowing really what you want to achieve, we can attain very high levels.
Doc, thank you so much for your time this morning. We're dedicating a song to you. Yeah, because you said you listen to a lot of Zambian music. Now we're giving you a reason to listen to more of Zambian music. This one is a song done by 76 Drums. It's called Big Machines. All right? So he's referring to some people that have done it in life. They're influential. So like he says, you're a big machine.
Yeah, we think you're a big
watch
machine.
Watch this and enjoy it from us to you.
Thank you so much.
Big Machines up next.